Topic number 3. Antisepsis, sterilization of surgical instruments, dressings and operating underwear. Lecturer Shevchenko Alexander, Baltic Federal University, Medical Institute, Kaliningrad 2020. Surgical infection. Its introduction, reproduction, spread of foreign microorganisms with the subsequent formation of a purulent focus in the patient's body. As we see in this picture, we have traffic ulcer. Sources and ways of spreading surgical infection. There is an exogenous pathway of transmission and an endogenous pathway of transmission. We have two major pathways: exogenous, from another patient or from the environment, and endogenous pathway. It means the microorganism is in our body already. Transmission. Transmission is the passing of a pathogen causing diseases, from the handshake, for example. Endogenous infection is a disease arising from an infectious agent already present in the body but previously asymptomatic. An infection that enters the wound from the patient's own body is called endogenous. Its main sources are the patient's skin, internal organs, and pathological foci. Endogenous infection is called the source of which is in the body of the patient. Its sources can be the patient's skin, gastrointestinal tract, oral cavity, as well as foci of infection, the presence of which is due to the existence of concomitant diseases. The most common of them are carious teeth, inflammatory diseases of the urinary tract, chronic tonsillitis, adnexitis, chronic bronchitis, etc. It can spread throughout lymph, blood, or via contact. Ways of transmission surgical infections. Blood contact, airborne, fecal-oral transmission, contact or implantation. Airborne, coughing, sneezing, breathing. Airborne infection, really small dry and wet particles that stay in the air for long periods of time, allowing airborne contamination even after the departure of the host. Particle size less than 5 nanometers. Droplet infections, small and usually wet particles that stay in the air for a short period of time. Contamination usually occurs in the presence of the host. Particle size more than 5 nanometers. As you see on this picture, we have two persons, one of which was already ill and another one was healthy. We see here the part of coronavirus, because now it's all over the internet and it's difficult to find another picture. So this part travels from the lungs of the infected person to the environment and to the non-infected person, who now infected too. Fecal-oral transmission, usually from unwashed hands, contaminated food or water sources due to lack of sanitation or hygiene, an important transmission route in pediatrics, veterinary medicine and developing countries. As we see here, young man drink water from his own hands. If he didn't wash his hand with soap, he can get fecal-oral transmission of infection. Another type of transmission is contact type of transmission. We have two different types of contact transmission: direct physical contact, touching an infected individual, including sex contact. I hope this is not interested you in the context of the surgery. And indirect physical contact, usually by touching a contaminated surface, includes soil from it. So when we have this picture, we need another person to contact, like handshake, and indirect contact through the different parts of the environment. Blood contact, percutaneous or transcutaneous. Per in Latin means through skin, because cutaneous means skin, so percutaneous means through the skin. Usually appeared after blood-to-blood contact during transfusion, surgical operations, or invasive manipulations. Surgeons highlight another one type of transmission of surgical infection, its implantation. Implantation is the penetration of microorganisms or their spores located on the surface or in the thickness of material substances when the latter is implanted into the human body. For example, with non-sterile suture material or solutions for parenteral administrations. Implantation infection is caused by foreign objects introduced into the tissue. Suture material, prostheses, metal structures for osteosynthesis, drugs introduced with non-sterile needles and syringes. It gives the most dangerous complications in the form of suppuration, sepsis, osteomyelitis, infection of the patient with serum hepatitis or HIV. Hospital-acquired infection. Another one, very important definition. Any clinically expressed diseases of microbial origin that affect the patient as a result of his hospitalization or visit to a medical facility for treatment or after discharge from the hospital. For example, wound infection, as well as hospital staff under their activities regardless of whether symptoms of these diseases are manifested are not during the stay of these persons in the hospital as defined by the World Health Organization. What are the most touched and most contaminated surfaces in the hospital room? We have particularly this picture for the methicillin resistant Staphylococcus aureus contaminated surfaces, but it belongs to all infections in the world. So we see the patient, we see the bed lines, it's often touched, bed rails often touched, bed table, too very often touched, all structures with flat surface, all furniture, and of course sink. You see here little pictures of skull and bones. It means it can be origin of the hospital-acquired infection, because any surface here can be touched. We have pillow, bed, rails, ICU monitor, lamp, infusion pump, flat surfaces, all these surfaces very often touched. That is why if you touch them you must wash your hands. So sources of surgical infections. First of all, it's patients. Second, medical personnel, because if someone don't wash their hands after they touching some surface, they can give to another person hospital-acquired infection. Person caring for sick, nurses, and of course visitors. How we can prevent infection? Infection is the most important and preventable cause of impaired wound healing. Microorganisms can reach tissues during surgery or manipulation of surgical wound carried and transmitted by people, including patients, inanimate objects, including instruments, sutures, linen, swabs, solutions, mattresses, blankets, air around wounds, which can be contaminated by dust and droplets of moisture from anyone assisting at surgery or caring for wound. Aseptic treatment of wound, an attempt to prevent bacterial contamination from these sources during surgery, initial phase of healing. Here we see a monument to Ignaz Semmelweis. We have here sign, Der Retter der Mutter. It's in German. It means savior of the mothers. In 1941, Ignaz Semmelweis, a Hungarian obstetrician, was working at a Vienna maternity hospital. He was shocked by the rate of women who developed puerperal fever. He documented that the infection was 20 times higher in the ward where the medical students were delivering babies than in the next ward that was staffed by midwifery students. The medical students were also routinely working with cadavers. He compared the rates of infection with a similar hospital in Dublin, Ireland, and hypothesized that it was the medical students who somehow were infecting the women after labor. He instituted mandatory hand washing May 1847, and infection rates dropped dramatically. Louis Pasteur proposed the germ theory of disease and began his work on cholera in 1865 by identifying that it was microorganisms that were associated with disease. Such a great man was this Ignaz Semmelweis. But medical society didn't accept his ideas. He must left his practice and he died in the mental impairment hospital. Actually, he made suicide. Infection is the invasion of an organism's body tissues by disease-causing agents, their multiplication and the reaction of host tissues to the infection agents and the toxins they produce. Asepsis, a set of measures aimed to prevent the entry of microorganisms into the wound. Another painting here, you here see Joseph Lister. It's a great surgeon who provides, first of all, asepsis to surgeons. Another person here sprays a carbolic acid to decontaminate the wound, the skin and hand of the surgeon. When skin, wound or air is in contact with the carbolic acid, it becomes decontaminated from germs. Organizational forms of providing asepsis. In the surgical department, the wards should have 2 or 4 beds. The area for one bed should be at least 6.5–7.5 square meters. Floors or walls, furniture in the wards should be easily cleaned and disinfected. In small hospitals like the district hospital has one surgery, but it is necessary to separate the festering patients from the clean ones. Ideally to have 2 dressing rooms for purulent patients and the clean patients' dressing room, and if it is not possible to have 2 dressing rooms, first deal with the clean patients and then purulent ones. In dressing rooms you need to work in scrubs, caps, masks, gloves and shoe covers. Methods used to prevent airborne infection: washing the floor, wearing surgical masks, wearing shoe covers, treatment of air with ultraviolet light. Prophylaxis of contact and implantation infections. Wearing sterile gloves, wearing sterile scrubs, wearing surgical hats. All objects that touch the operation field must be sterilized. Treatment of operating field with antiseptics. Organization of the surgical department and operating unit. A surgical hospital contains the main functional blocks, which are as follows: a surgical block, surgery departments, emergency rooms, treatment rooms and dressing rooms. So, operating unit. An operating unit houses special rooms for operating on patients. It has to be isolated from surgery departments on a separate floor or detachment of the building and be connected with them by a corridor. To provide the regimen of sterility, there are 4 special functional zones in the surgical block. First one, the sterile zone. The operating theater to operate on patients, scrub-up room for preoperative cleansing surgeons' hands and arms, and the room for sterilization, to sterilize the instruments to be used during the operation. The clean zone, the rooms for personal hygiene and changing clothes of the staff. Third, the technical zone, the rooms where apparatus for air conditioning or oxygen supply and vacuum devices are stored. Fourth one, the dirty zone, the sister room, the room of the head of the surgery and the one for dirty clothes, etc. So here we see operative theater. It's placed in the sterile zone. We see here operation table, a lamp, it's laparoscopic table, it's anesthesiologist table. Here we have balloon with some gas, it's a vacuum machine, it's table of the nurse or anesthetist. One of the prophylaxis methods of contact and implantation infection sterilization. Sterilization refers to any process that eliminates, removes, kills, or deactivates all forms of life, in particular referring to microorganisms such as fungi, bacteria, viruses, spores, unicellular eukaryotic organisms such as Plasmodium, etc., and other biological agents like prions present in a specific surface objects or fluid. Sterilization of operating clothing, underwear, surgical gloves, dressing and sutures, surgical instruments and drains. Prevention of microorganism contact with the wound. Prevention of the contact contagious infection requires that everything that touches the wound should be sterile. This is achieved via disinfection of instruments as well as cleaning the surgeon's hands and operative site. Sterilization of the suturing material prevents both containing and implant infection of the wound. Sterilizing instruments, operating sheets, towels, and dressing materials involves the following stages. Stage first, preparation of the materials. Stage second, preparing for sterilization itself. Stage 3, sterilization. Stage 4, safekeeping of the materials sterilized. All these stages are to be performed in accordance with specific standards, sterilization and disinfection of materials for medical use. Stage 1, preparation of the materials, is aimed at through mechanical cleansing of instruments, removal of biogenic compounds and destruction of hepatitis viruses. The person responsible for this should always wear gloves. The instruments that were used but not infected will be washed under running water separately with a brush for 5 minutes. In contrast, blood-stained equipment must be washed immediately without subsequent drying, then soaked in one of special washing solution warmed to a temperature of 50 degrees of Celsius for 15-20 minutes. After soaking the instruments, particularly their corners and folds, instruments are washed with brush in the same solution and then rinsed in the warm water for 5 minutes and then distilled for another. The instruments are then packed into a drying air sterilizer under the temperature of 85 degrees of Celsius. Thereupon, these are ready for sterilization. The instruments contaminated with pus or intestinal contents are first soaked in N ml containers with 5% lysol for 30 minutes. Then washed in the same solution with brush, rinsed with running water and soaked in one of the washing solutions. The further steps are as given above. It is noteworthy that the equipment used to operate on patients with anaerobic infection should be soaked in a special solution that contains hydrogen peroxide 6% and washing agent 0.5% for 1 hour. Then washed with a brush in the same solution before boiling for 19 minutes. It is only after this that the instruments will be ready for thorough sterilization, as in the case with instruments which have not been infected. So, currently medical gloves are disposable and previously sterilized by manufacturer, so we cannot sterilize them or reuse them. To make sure the materials are free of blood stains following sterilization, the benzodiazepine test is applied. 3 drops of 1% benzodiazepine and hydrogen peroxide are put on the material or instrument tested. A bluish-green coloration suggests the presence of blood. This requires that washing stage 1 be repeated. Stage 2. Arrangement and package for sterilization. For sterilization in air drying sterilizer, the instruments are arranged in a metallic box, vertically and in one layer within the lid open but lined by its side. Sets of instruments for typical operations on the heart, lung, bone vessels are sterilized together. They are arranged on special trays and wrapped in sheets. Stage 3. Sterilization. Sterilization of instruments, glass containers is done within dry air oven. The materials are freely arranged on the sterilizer shelf and the apparatus switched on. With its doors open, the sterilizer is heated to a temperature of 80–85 degrees Celsius to dry its interior and the instruments for 30 minutes. The doors are then closed and the temperature increased to 180 degrees Celsius and maintained automatically. Within 60 minutes, the materials are sterilized. After switching off and cooling to 70 or 50 degrees Celsius, the doors is opened. The metal container with the instruments is covered with its sterile lid. Within the next 15 to 20 minutes, when the sterilizer is cool, the materials can then be removed. Here we see a nurse that take instruments to boiling sterilization. It's all methods where we place some instruments into the boiling water. Sterilization of instrument can be done in an autoclave. The wrapped up materials are packed into the sterilizing chamber. In the terms are packed into a dressing box. Then its lids should be opened. Dressing boxes and other containers must be placed freely to allow an equal distribution of the steam. Surgical instruments are sterilized within 20 minutes at 2 atmospheres. 1 atmosphere is 1013 Pascal, which is the equivalent of 132.9 degrees of Celsius. The starting time for sterilization is counted from the start of the required pressure. Plastic drainage tubes are sterilized at 1.1 atmospheres, steam temperature of 120 degrees of Celsius for 45 minutes. When the dressing box is removed from the autoclave after sterilization, its opening is closed immediately. Sterilization of optical instruments, laparoscopes, thoracoscopes and heliodecoscopes can be done in alcohol solutions of hexadiene. Sterilization of apparatus and instruments using chemical compounds should be done in metallic containers with covers to prevent evaporation and pollution of the air in the room. In the absence of special containers, they are sterilized in containers made of enamel or glass. The instruments are covered with water such that all of them are under the water and covered with the lid. Stage 4. Keeping the sterilized materials. Sterile materials are kept in special containers. Sterile and non-sterile items may not be kept at the same container. Materials can stay sterile in the dressing box, which has not yet been opened for 72 hours. If before packing in the dressing box the materials were wrapped in towels, sheets or napkins, as in the case with rubber drains, then they can stay sterile for 3 days. In cases if the filter is installed in dressing box, the material remains sterile for up to 20 days. There are 3 ways to lay the material in Schimmelbuch's sterilizer. This box is called Schimmelbuch sterilizer, or in Russian BIX. In small operating room, so-called universal styling is used. In Schimmelbuch's sterilizer, all types of materials that may be required for the operation are laid in layers, and in each layer sectors. In the first layer, place napkins for hands and a dressing gown, a mask, cotton swabs, in the second sheets and towels, and in the third napkins, tampons, balls, etc. Second, for a certain type of operation, targeted stacking can be used. All the material necessary, for example, for stomach resection, is placed in the Schimmelbuch's sterilizer. In large operating rooms, they often use a specific type of styling. Each item has a specific type of material, bathrobes, sheets, tampons, etc. In order for the steam to pass freely inside the drum, all items are placed loosely, labels with the date of sterilization and the name of the responsible person conducting the sterilization are attached to the handle of the drum cover. In the current time, we most often use disposable, not reusable suture materials and tools. We have another type of sterilization, which is called cold sterilization. Radiation sterilization relies on ionizing radiation, primarily gamma X-ray or electron radiation, to deactivate microorganisms such as bacteria, fungi, viruses, and spores. Due to numerous advantages over heat and chemical-based sterilization techniques, this method is particularly attractive in medicine and healthcare-related fields. For example, radiation sterilization is readily applied during tissue allograft preparation, pharmaceutical packaging, and medical device manufacturing. Ultraviolet germicidal radiation is a disinfection method that uses short wavelength ultraviolet to kill or inactivate microorganisms by destroying nucleic acids and disrupting their DNA, leaving them unable to perform vital cellular functions. So, chemical sterilization. Use of chemical solutions to kill disease-causing germs. Ethanol, chlorhexidine, formic acid. Sterilization control. Control of sterility. The sterility of the items and the working regime of the steam sterilizer can be controlled either by direct or indirect methods. Direct method. Inoculation of medium with a swab of the dressing material. To inoculate medium with a swab, open the dressing box in the operating theater using a sterile instrument. Soak a piece of sterile gauze in the normal saline, which is passed several times on the material to be tested. Then drop the piece of the gauze in the sterile test tube and send it to the microbiological laboratory. Bacteriological tests. A test tube that contains reference non-pathogenic cultured microorganism known to die. If exposed to a certain temperature is used. Place the test tube inside the dressing box and send it to the laboratory after sterilization is over. Absence of bacterial growth implies that the items are sterile. The swabs should be taken from once every 10 days. And we have indirect methods. Control of sterility materials is done each time they have been sterilized. Compounds with non-specific melting points are used for this purpose. Benzoic acid, resveratrol, antipyrine. These compounds are kept in ampoules that can also be put into the test tubes and closed with gauze plug. 1 or 2 ampoules are placed in between the layers of material to be sterilized. Melting of the powdered compound into a liquid mass implied that the temperature in the box was at least as high as the melting point of the compound. If sterilization is performed at 2 atmospheres, compounds with the higher melting points are used. Ascorbic acid, succinic acid, pilocarpine, hydrochloride, thiourea. Thermometry is known to be the most objective indirect method of sterility control. In each dressing box, 1 or 2 thermometers are placed in between the layers of materials to be sterilized. The readings will indicate the maximum temperatures but not the exposure time. For how long such a temperature was maintained in the chamber. Hence, this method does not preclude the use of direct methods like the bacteriological tests. Levels of sterility space of operation unit. To provide the regimen of sterility, there are the 4 special functional zones in the surgical block. First one, the sterile zone. Operating theater to operate on patients, scrub room for preoperative cleansing surgeons' hands and arms, and the room for sterilization to sterilize the instruments to be used during the operation. Second one, the clean zone. The rooms for personal hygiene and changing clothes of the staff. The technical zone. The rooms where apparatus for air conditioning or oxygen supply and vacuum devices are stored. Fourth one. The dirty zone. The sister room, the room of the head of surgery and the one for dirty clothes, etc. The operating theatre is equipped for using laminated sterile condition. Cleaning of operation theatre. We have 3 major types of cleaning of operation theatre. Current cleaning, final cleaning, and general cleaning. Current cleaning, performed during the operation. Despite the fact that a basin is placed near the operating table, for the used material, napkins, tools, and used operating underwear may fall on the floor. They are immediately removed in special containers when performing an operation on the abdominal organ. The contents of the abdominal cavity fall on the floor, which is removed with a clean rag. After that, the floor is wiped with a disinfectant solution. Final cleaning, daily at the end of the working day, and general cleaning at the end of the working week in the operating room and at the end of the month in the entire operating block. Next step to antisepsis is hand washing. Hand washing, the single most important measure for prevent of infection. Plain soap and water is effective for removal of visible contaminants. Wash with vigorous mechanical action on all hand surfaces for at least 30 seconds, washing above wrists, removing jewelry. Nails are areas of the greatest contamination. Rinse under a pour of running water. How to wash our hands? First of all, we must wet hands with the water from the tips of our toes to the elbows. Second, apply enough soap to cover all hand surfaces, on each hand like a spoonful. Rub hands palm to palm. You must understand that every movement here you must repeat at least 5 times. So, rub hands palm to palm. Next, right palm over left dorsum with interplaced fingers and vice versa. Fourth, palm to palm with fingers interplaced. 5. Backs of fingers to opposite palms with fingers interlocked. 6. Rotation rubbing of left thumb clasped in right palm and vice versa. 7. Rotational rubbing backwards and forwards with clasped fingers of right hand in the left palm and vice versa. 8. Rinse hands with water. 9. Dry hands thoroughly with a single-use towel. Use towel to turn off faucet. 4 hands and now safe. Your hands are now safe. To effectively reduce the growth of germs of hands, hand washing must last at least 40 to 60 seconds and should be performed by following all of the illustrated steps. After hand rub. To effectively reduce growth of germs on hands, hand rubbing must be performed by following all of the illustrated steps. This takes only 20 or 30 seconds. Apply a panful of the product in a cupped hand, covering all surfaces. Rub hands palm to palm, right palm over left dorsum with interlaced fingers and vice versa, palm to palm with fingers interlaced. Bags of fingers to opposing palms with fingers interlocked. 6. Rotational rubbing of the left thumb clasping the right palm and vice versa. 7. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are safe. Gowning. Place arm through sleeves. Have an unscrubbed assistant pull gown over shoulders so hands go through sleeves. Assistant will tie back of gown. Gloving. Surgical gloves prevent transmission of HIV and other infection throughout contact with blood, other body fluids. Easiest to have someone who is already gowned and gloved to assist. Promptly change a glove punctured during surgery. Rinse hand with an antiseptic or rescrub. Gloving without assistance is a very important moment too, because not all the time we have assistant, not all the time we have nurses around us, but we need to wear gloves. Open sealed package and of sterile gloves before scrubbing, gowning, place in package or on sterile surface. Once gowned, take cuff of the left glove with right hand. Make sure thumb in correct position. Slide glove onto left hand. Wriggle fingers slightly to help. Only touch inside of glove. Cuff with bare hands. Slide fingers of gloved left hand into the cuff of right glove. Pull glove onto right hand in similar fashion to placing left glove. Ensure that cuffs cover ends of both gown sleeves. Next, important definition, the operating field. Operating field is the area of the skin where surgery is performed. It is important to clear it of pathogenic microflora, which can cause postoperative complications. Preliminary preparation of the site of the intended surgical incision, operation field, begins on the eve of the operation and includes a general hygienic bath, change of linen. On the day of the operation, the hair is shaved dry directly at the site of the surgical access, then the skin is wiped with alcohol. According to the method Grassic-Filonchikova, soaked in disinfectants 5% solution of iodine, 1% iodoperon, 1% solution iodonate. Sterile swabs are widely rubbed the skin from the center to the periphery within 1 minute. If we deal with suppurative wound, we rub the skin from the periphery to the center. Isolate the operating field with sterile underwear. Reprocess for 30 seconds with the same tool. Before suturing the wound, the field is again wiped with an antiseptic. Once again, decontamination is performed after suturing. Infection prevention and universal precautions. Wear gloves during exposure to blood or body fluids. Wash hand afterwards. Wash immediately with soap and water in case of skin exposure, whether from a splash, glove puncture, or Non-gloved contact. Wear protective glasses where blood splashes may occur. Wash out eyes with water as soon as possible if splashed. Wear protective gown or apron if splash potential exists. Operating theatre. Keep all doors to operating theatre closed except as needed for passenger of equipment, personnel, patients. Store some sutures, extra instruments. Minimize number of people allowed to enter. Keep room uncluttered, easy to clean. Between case, clean and disinfection table, instruments, surfaces. Thank you for your attention.